Hello, historians. Welcome back to another episode of Professor Davis Says, where anybody can be a historian. Now, remember, we told you from day one, this series titled Pandemics of the Past is for the entire month of April. Now, today, this episode is our final episode for this series, but I want you to continue watching. But before I ask you to continue watching, please be sure to hit like, be sure to give the thumbs up, be also certain to subscribe. Yes, please subscribe to this channel because we can't do this without you. Now, we talked about the past issues and pandemics from a global and national standpoint. All right, we're making it relevant to COVID-19 here in 2020. And those issues were the Spanish flu, the Great Depression, World War II, and the Freedom Riders, which came under the umbrella of the Civil Rights Movement 50 plus years ago. Okay, so now this series we're talking about COVID-19, or the novel coronavirus, which the medical term for it is COVID-19. CO means the CO is the medical term. Corona, V virus, D disease -19, giving it the year that most minds have identified it being discovered in 2019. And so that's where you get the term COVID-19 from, because there's a series of other coronaviruses that have been pre-existing for a while, and they all affect the respiratory system. And of course, it affects other parts of your body as well. And so again, my hashtag is, hashtag Professor Davis Says for this channel. But we want you to also keep in mind that novel coronavirus is something that's real serious. And the numbers are this: globally speaking, roughly 1.2 million people have been infected. Globally speaking, just under 100,000, at this point, have died from this COVID-19 disease. And here in America, the numbers are under 400,000 have been infected by COVID-19. And also, in terms of death, we have about over 12,000 people have succumbed to this disease. And here in Arkansas, we have about 932 cases of the virus, and the numbers of people have died from it hadn't reached 100 yet. And so, of course, we want to not spin the story as something that's all negative, doom and gloom, because it's not. That's not what we promote. That's not what this channel is about. This channel is to inspire, to inform, to get you to share, and for us to empower. We mentioned that before. But again, I'll always look at the glass half full rather than half empty. So we want you to know that these numbers are being discussed, but you also have to add into the equation the number of people that have recovered from the novel coronavirus, okay? When you see these stats, also look at that stat too. You have to always look at that stat too. There's some people who are walking and talking. Some are even on the news. I think it was from CNN, Chris Cuomo, who has, he's still in recovery, if you will. There's several other leaders, state, local, and world leaders who have been affected by the novel coronavirus. All right, so again, this is not a doom and gloom message. This is a message to empower you. And of course, we want you to look back and see what we've done in the past from a global standpoint, and as Americans, what we've done in the past to equip yourself with these tools moving forward here in 2020. Because research says these minds that are on this disease now, whether it's the Trump team or the CDC, World Health Organization, all of them are working together, to fight this disease, but also to say that there's another wave coming. And so we have to be well equipped with doing that. And that's following these best practices moving forward. We have to follow our local, our state, and our national, global rather, best practices moving forward. That's one way to know that you can help, survive and actually thrive from the novel coronavirus. We can look back at what they did in 1918. Of course, covering up the face. That's not necessarily what you call a new norm, but it's, it is new and it is normal, but it's a game changer. Okay, it's a lifestyle change we're talking about lifestyle changes. Okay, so again, that is one that we have to do moving forward, especially when you're in a big crowd, and we shouldn't be. Okay, look at back what they did for the Great Depression. You know, there was different monetary institutions in place to help people who were living in poverty, and also those that were well-to-do. And so there were different governing factions in place to help subsidize some of the issues that were going on. And as a result from that, we had welfare. Okay, so different programs were given to us to help suppress that depression. Look at World War II in terms of what they did by people working at home, job opportunities were being created. And of course, that key word, creative or being creative, okay, again, keyword being creative or job creations were in place that helped a lot of people who were at home and some who were abroad when they came back home. Okay, so this is another way that we can help with this 2020 era of COVID-19. All right. Also, you have to think about what happened during the civil rights movement between 1955 and the early 1970s, late 1960s. Okay, more specifically with the Freedom Riders, how they all networked. People who didn't look alike, people who had different tax brackets, people who were from different parts of the country, all came together for the common good of humanity. And of course, to help suppress and to help eliminate racial discrimination, segregation, the Jim Crowism, if you will, and to create a better playing field moving forward as it relates to us to grow as a country. Okay, so again, there's plenty of ways, plenty of methods that we can help integrate in 2020 when it comes from us being in our house, when it comes to us being at work, when we do go back to work, when it's all right to do that. Remember, we have to not just suppress this disease, we have to help eradicate it if at all possible. Okay, because we've heard about the second wave that's coming possibly in the fall, and we don't want that. But it's a realistic idea that it may come back, which in the past, with past world pandemics, sometimes they come back. So again, we have to have a lifestyle change, okay, which is the new norm, all right, moving forward. So again, I want to thank everybody for watching this series, Pandemics of the Past, okay? And remember, I'm Ed Davis, your social historian. Be sure to stay tuned for our next episode, okay, where we're having another hot topic we're going to talk about, and I want your input. So remember to be sure to subscribe to this channel, hit the thumbs up, hit the likes to it, and remember, Professor Davis says.